Hi, good morning, I'm Ashley Rubin. I'm the invigilator for the OET test conducting on the 11th of May 2020. May I know your name, please? Hi, good morning. My full name is Victoria Green. Can I have your passport, please? Yes, here it is. Can I have your candidate number, please? My candidate number is 391070. All right. We can now begin the warm-up session. How do you define great patient care? I believe great patient care means that you are patient-centered, which means that nurses address the patient's concerns and respond as quickly as you can to their needs. It means that a nurse should take time to educate them, so that when the patient leaves, they feel as if you took good care of them and would recommend your facility to others. Describe a mistake you made on the job or in clinicals, and how you handled it. I remember about one of my initial days in ICU as a registered nurse. That was a very busy day, as I got one admission and a respiratory collapse. I did everything to my patients very genuinely. But unfortunately, I forgot to record the admission details of the new patient in the system, which was provided for our department. After my duty, I was back to hostel, and when I recalled about the day, suddenly, I remembered about the incident, and informed one of my colleagues during the second shift. Thankfully, she did it accurately with my guidance. Describe a time when a coworker or manager made you upset. Gratefully, I really haven't such a bad experience. But one thing which I remember was during my training period. We were divided into small groups, and one of our group members was late to the work. And because of her, the trainer gave a punishment for the whole of our team. Even though it was a bit frustrating. Later, we all realized the value of being punctual in the medical profession. Describe the most valuable constructive criticism a former manager or charge nurse has given you. I still remember the day when my ward in charge advised me to take off. It was during the start of my career, and I had worked for around 20 to 25 days without a single day off. I was pushing myself too hard to gain the work speed of my coworkers who were seniors to me. Later, after her advice, I realized that being healthy is an important factor to take care of others. What's the most important quality a nurse can have? Of course, I think it is important to have competence in nursing clinical skills, but the foremost quality a nurse should possess is a genuine want to help people who are sick and helpless. That's the end of the warm-up session. Now we can move on to cue card sessions. I'll help you with the task questions. This is your task card. You have 3 minutes to prepare with the task card. Your time starts now. Your time is up. You can now start your role play. Hello, my name is Richa, and I am one of the registered nurses in this facility. What do you prefer to be called? Hello, my name is Rebecca Robinson. Hi, Mrs. Robinson, how are you? I'm really upset. If you don't mind, could you please tell me my son's MRI result? Yes, I have the test result. And, unfortunately, the results are not good. Your son is suffering from a tumor at the back of his brain, on the right side. He needs a surgery for his recovery. What? My son has a tumor. It's unbelievable. He's so young, and I just don't know what to do. I realize that this comes as a shock to you. I also understand how you feel. Anyways, I am here to reassure you that he's going to be okay, and will make a complete recovery soon after the surgery. Initially, I thought that it was just a flu. As days passed, I felt that he was not recovering. That's why I took him to the hospital. And now you say that it is a brain tumor. It's really shocking. Yes. Regrettably, it's true. The symptoms were much similar to the flu. But, with proper investigations, we have confirmed the diagnosis of a tumor in his head. The headache was because of the pressure at the back of his head. Fortunately, you made the right decision to bring him to the hospital in his early stage itself. Can you please tell me whether he is going to be okay? Yes. Don't worry about his recovery. All the doctors here are highly skilled, and definitely, Mark will receive the best possible treatment and care. I assure you that he will be able to recuperate soon. I wish I could see my son. I haven't seen him for the last 5 hours. And the doctor said that I cannot see him for another hour. I understand your concern regarding Mark. But, Mrs. Robinson, I apologize to you for your long waiting. Mark had been sedated for the MRI scan. Right now, he is in the ward, under close monitoring of my co-staffs. Don't worry. You will be able to see your son shortly. Nurse, I don't know how you will feel about me. But I am not able to recover from the shock even now. I know you are devastated. Take your own time to accept the situation. And let me know if you have any queries regarding what I have been told. Are you sure that he needs surgery? You know it's too scary. Being his mother, I can't even think that my son is going to be operated on. Could you please tell me whether the surgery is risky? I know it is very difficult for you to realize the things. Don't be worried or confused about the surgery. Mark is in safe hands. The doctor has advised a surgery because a tumor needs to be removed from Mark's head. After the surgery, he will be monitored for 1 more week in the hospital in order to check the progress in his condition. Oh my God! Isn't my child going to be in a lot of pain? Being a mother, your concerns are reasonable. However, it is not really necessary to bother much about his pain, as he will be under painkillers. Definitely, painkillers will help him to relieve his pain. But, still I'm worried about its chances of recurrence. Nothing to worry like that. As per the doctor's finding, Mark's tumor is non-cancerous, and these kinds of tumors did not reoccur once they have been removed. So, it won't cause any further problems. Moreover, the doctor will repeat MRI tests during your follow-up appointments to monitor Mark's condition. Alright, but my present concern is about this tumor's effect on Mark's cognitive abilities. Does it have a long-term impact on his brain functions? No need to take tension on those things. Same like other surgeries, Mark needs some time for a complete recovery. Until that, he may face some troubles with physical abilities, behavior, or speech difficulties. But, don't worry, we will provide support for him to overcome any problems that he may have. Could you please give me more details regarding the options that would be available for me? Being a single parent, I am really anxious about the care which I could give for his faster recovery. Your concerns are really understandable. During the time of discharge, we will provide you with detailed written and verbal instructions about the care at home. Additionally, occupational therapists, physiotherapists, speech therapists, and visiting nurses will be able to assist Mark in transitioning to healing at home if required. Nurse, I was not a good mother to him. I am so busy with work. If I had taken enough care, Mark would have been fine today. It's all my fault. Don't feel upset, Mrs. Robinson. It is not because of your fault. The exact cause of a tumor is unknown. I realize that the news has confounded you. As you are a single parent, you are under a lot of pressure. Now, it is equally important for you to take care of yourself. Then only you will be able to take care of your son. Yes, what you are saying is right, but it all happened so suddenly. And still, I am not able to overcome the shock. Yes, I do understand that you need some time to get adapted to this situation. I can assure you that we are going to be there with you and Mark during each and every steps. Moreover, I can give reference to some local support groups where you can meet many people who have survived from brain tumors. Definitely, that will be a great opportunity for you to know more about it. I would really appreciate it. Speaking to other parents might help me to resolve my stress further. Yes, sure. Along with that, you will receive ongoing support from us throughout. Do you have any other queries? Not for now. You have given me a great support during this hard time. I am really grateful to you. With pleasure, Mrs. Robinson. Anyway, I will check on Mark's condition and let you know shortly. Thank you so much, nurse. No worries, Mrs. Robinson. Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.